Hey everyone! Today we're going to talk about something that's super important for our health, sexually transmitted infections, or STIs. The whole point here is to give you a clear, no-nonsense guide to understanding them, managing them, and of course preventing them.
So let's just start with a number to put all of this in perspective. Get this. Worldwide, there are about 374 million new cases of STIs every single year for people between 15 and 49. And that's not the total number of people who have one, that's how many new infections happen annually. It just shows you how incredibly common this is.
Now, I know a number that huge can feel a little overwhelming, but here's the most important thing to remember. Even though STIs are super common, the vast majority of them are totally manageable and treatable, especially with the right info and care.
So that's our mission today. We're going to walk through exactly what you need to know. The goal is for you to leave this feeling empowered, with a solid understanding of STIs, so you can protect your health and feel good about your decisions.
All right, let's kick things off with the absolute basics. Before we get into all the details, what even is an STI?
So, at its heart, an STI is just an infection that gets passed from one person to another through sexual contact. And that means more than just one thing, right? It can include oral sex, anal sex, or genital sex. It's usually spread through body fluids, but sometimes it can be passed just by skin-to-skin contact with an area that's infected.
Okay, so now we've got the what. Let's dig into the how and the what if. What causes these infections? And more importantly, what can happen if they aren't treated? Because honestly, understanding the risks is the first step to preventing them.
You know, it's not just one kind of germ that causes STIs. They actually fall into three main categories. First, you've got bacteria. Think chlamydia or syphilis. Then there are viruses, like herpes or HIV. And finally, you've got parasites, like trichomoniasis. And as we're about to see, knowing which one is causing the infection is a really big deal when it comes to treatment.
And this right here is exactly why catching things early is so crucial. See, an STI that's left untreated isn't just a problem in one spot. It can actually get into your bloodstream and travel around your whole body, and that can lead to damage to your internal organs and some really serious long-term health issues.
And these complications can show up differently for different bodies. In women, an untreated STI can cause something called pelvic inflammatory disease, or PID, which can seriously damage reproductive organs and even lead to infertility. For men, it can cause really painful infections in the testicles or mess with the urethra, making it hard to pee.
And some of these long-term risks are no joke. If you leave syphilis untreated, it can eventually cause damage to your heart and brain. HIV, as we know, weakens the immune system, making you vulnerable to all sorts of other infections and even some cancers. And some types of HPV are a major cause of cervical, anal, and throat cancers.
Okay, I know that last section was a little heavy, but now we get to pivot to the part where you take back control. Let's talk about solutions. How do you spot a potential infection and get a proper diagnosis?
This is probably the #1 question on everyone's mind, right? How would I even know if I had an STI? What am I supposed to be looking for?
So a lot of the time, the first signs will show up right where the infection got in. That could be things like sores or rashes, maybe some unusual discharge, some itching or pain when you pee or have sex. If you notice any of that stuff, that's your body's signal to go see a doctor.
And now for what might be the single most important thing you'll hear today. A lot, and I mean a lot, of STIs are totally asymptomatic. That means they have zero symptoms. You could feel perfectly fine, have no idea you have an infection, and still be able to pass it to someone else. This is exactly why regular testing is so important if you're sexually active.
But here's the good news. Finding out what's going on is actually a really straightforward process. It all starts with just having a confidential chat with a doctor or nurse. From there, they'll figure out the right test for you, which is often just a simple blood test, urine sample, or a quick swab. And then you get a clear answer and a plan to get things sorted.
So let's say you get a diagnosis. What's next? Well, this next part is all about taking back the wheel through really effective treatments and, just as importantly, smart prevention.
Let's just pause on this for a second because it's really hopeful and important. The vast majority of STIs can be treated effectively with medicine. For most of these infections, we have proven treatments that really work.
Now, the way we treat an STI completely depends on what caused it. For those bacterial ones we talked about, like chlamydia, they can usually be completely cured with a course of antibiotics. Boom, it's gone. But for viral STIs, like herpes or HIV, it's more about management.
Antiviral meds are amazing at controlling the virus and reducing symptoms, but the virus itself often sticks around for life. And here's a critical piece of the puzzle. Treatment isn't just about you. To really break the chain and keep you from getting infected all over again, it is essential that any and all of your sexual partners also get tested and treated.
We've covered treatment, but you know what's even better than treatment? Preventing an infection from ever happening in the first place. So let's wrap this up by putting together a practical toolkit for prevention.
Look, prevention matters for everyone, but this data shows why it's a huge deal for younger people. In the United States, a full half of all new STIs happen in people between the ages of 15 and 24. That's a massive number, and it just highlights why we need to be proactive.
So, what's in this toolkit? Well, you've got the fundamentals, like practicing safer sex by using things like condoms. Limiting your number of partners also lowers your risk. But we also have these incredible modern tools, like vaccines that can completely prevent HPV and hepatitis. And tying it all together is the strategy we keep coming back to. Get tested, and if you need it, get treated quickly to stop the spread.
And hey, condoms are a key tool here, but they only work if you use them correctly. That means a new one every single time. You have to put it on before any contact happens. Squeeze the little tip to get the air out. And a pro tip here, always use a water-based lubricant with latex condoms because others can cause them to break. Following these steps is what makes them so effective.
So, we've covered a lot of ground today. The causes, the risks, the signs, and the solutions. All of this information is now yours. So the final question isn't for me, it's for you. Now that you're armed with this knowledge, what's the next step you're going to take for your health?